Hello, my name is Megan, and I am the administrator for our primary care team. I will be presenting my findings on the potential benefits of adding a pharmacist to our diabetic team. Today we will be exploring two main questions. The first question is what outcomes will there be for adult patients with diabetes, and will there be improvements when a pharmacist is added to our primary care team that provides diabetic services? The second question is what role or services does a pharmacist offer in supporting patients with diabetes? The primary care team plays a critical role in managing diabetes effectively and usually consists of physicians, nurses, dietitians, and sometimes pharmacists. Our primary care team does not yet have a pharmacist on the team. A multidisciplinary team ensures there is a good quality medical care for patients at the clinic. Diabetes is a chronic condition that requires continuous medical care and patient self-management education to prevent serious complications. The implications of poor treatment can lead to heart disease, stroke, kidney failure, blindness, and lower limb amputation. It is important to utilize collaborative care when treating diabetic patients, as it can lead to better health outcomes. Introducing a pharmacist to our care team could improve the overall treatment of diabetic patients. Today, I will be summarizing my findings of the positive impact that pharmacists can give patients with diabetes at our clinic. Our first research question investigates improved outcomes for adult diabetic patients when a pharmacist joins our care team. Studies like enhancing diabetes care by adding a pharmacist and comparing clinical outcomes of a pharmacist-managed diabetes program with usual medical care have shown exceptional impacts on patients with diabetes. This includes better A1C levels, increased medication adherence, improved patient education, reduced risk of diabetes-related complications, increased patient satisfaction, improved blood pressure, and cholesterol levels. I found that there is an overall improved management of diabetes. In our exploration of improved outcomes with a pharmacist as part of the care team, the study Enhancing Diabetes Care by Adding a Pharmacist reveals considerable benefits. Some key findings include a significant reduction in HbA1c levels and a greater reduction in cardiovascular risks. This study concluded that adding a pharmacist to primary care significantly improved short-term and long-term outcomes for patients with type 2 diabetes. They used a mixed model method to assess the impact of the intervention over time. They gathered data on lab values for HbA1c, LDL-C, and blood pressure at baseline, and then again at 3, 6, 9, and 12 months. The results for a reduction in A1C levels and more patients achieving their blood pressure and LDL-C goals. The results showed significant improvement in the pharmacist-led group compared to the control group of patients given usual care. This slide highlights the vital role pharmacists play in diabetes management using evidence from the study Impact of Pharmacist-Led Management in Primary Care Clinics. The study shows that pharmacists are instrumental in medication management, optimizing treatment plans, and providing personalized care that addresses both the medical and educational needs of diabetic patients. This quantitative study used a retrospective chart review to analyze patient records and used a standardized survey that measured the patient's healthcare experience. They collected data using electronic medical records of 181 patients, which was divided into two groups. 112 patients were in the pharmacist-led group and 69 patients were in the control group of usual care. These results showed a reduction in HbA1c levels with a decrease of 2.2% when led by a pharmacist, while the control group showed an increase of 0.5%. This study reveals that there is an important improvement in diabetic care when there is pharmacist-led diabetes management in primary care clinics. Here, we delve into the pivotal role of pharmacists in managing cardiovascular risks among type 2 diabetic patients as detailed in the study. Adding pharmacists to primary care teams reduces predicted long-term risk of cardiovascular events in type 2 diabetic patients without established cardiovascular disease. This research highlights how pharmacists can contribute to lowering the predicted long-term risk of cardiovascular events through medication management and patient education. This quantitative study involved 102 patients in the intervention group and 93 patients in the control group of usual care. They used statistics from the Mann-Whitney-U test to compare risk score changes between the two groups. They found that there was a median reduction in risk score from the UK prospective diabetes study by 1%, and the Framingham risk score had a reduction of 1.2%. This indicates that a significant reduction in the predicted 10-year risk of cardiovascular events of the patients who have a pharmacist involved in their primary care. Here, we will examine the collaborative care model between pharmacists and physicians. As explored in the study, impact of a pharmacist-physician collaborative care model on patient outcomes and health services utilization. This study demonstrates that when pharmacists collaborate with physicians, there is a significant improvement in patient outcomes that includes better management of chronic conditions, more efficient medication use, and reduced hospitalizations. The quantitative study design analyzed and compared patient outcomes by collecting data from electronic medical records. They showed improvements in blood pressure, LDL-C levels, HbA1c levels, cholesterol, hospitalizations, and emergency department visits with patients who had a collaborative care team. This model demonstrates the value of integrated care. There was also an estimated cost savings of $2,619 per patient during the study, which is an improvement of 504%. Here I've conducted a comparative analysis that presents the contrast between our current primary care team structure against the proposed model that includes a pharmacist. Currently, our team effectively manages diabetes care, but I believe the addition of a pharmacist could enhance diabetes management at this clinic. The study's impact of a pharmacist-physician collaborative care model on patient outcomes and adding pharmacists to primary care teams reduces predicted long-term risk of cardiovascular events show that incorporating a pharmacist leads to improved patient outcomes with better management of diabetes and reduced cardiovascular risks. Our current structure can be compared to the control group in these studies, which demonstrates that when a pharmacist is added to the primary care team, there is a significant improvement that can't be denied. The groups that had a pharmacist involved in their care saw greater reductions in mean HbA1c levels, more patients achieving their HbA1c goals, LDL-C goals, and blood pressure goals, and had a greater reduction in estimated 10-year cardiovascular risks. As we consider adding a pharmacist to our team, it's important to weigh the pros and cons. These include improved medication management, patient education, overall control of the disease, and the potential for reduced hospitalizations. There's also potential for cutting costs per patient. However, there are also challenges that we must consider. These challenges include the costs associated with hiring additional staff to the program, There are training costs and integration costs into the existing, there are training costs and integration into the existing clinical structure. There is also potential for an overlap in roles, which could cause problems with the clinical structure. Based on my findings and the evidence presented, I recommend hiring a pharmacist to integrate into our primary care team. A pharmacist would significantly enhance diabetic management at our care clinic. The addition of a pharmacist would lead to improved patient outcomes, better medication management, and more efficient delivery of care. There will be improvements in blood pressure, LDL-C levels, HbA1c levels, cholesterol, less hospitalizations, and emergency department visits. There would be more education provided to the patient and a potential to save money for the clinic. While there may be challenges with initial costs and integration, the long-term benefits for our patients' health and care quality strongly support this decision. In conclusion, my thorough analysis of the literature strongly supports adding a pharmacist to our primary care team. This addition promises to enhance diabetes management for our patients and will provide improved patient outcomes. As we move forward, we can focus on the implementation of this change and ensure seamless integration. There will be maximum benefits for our patients, which is our top priority. I would like to thank you for your attention, and I am now open to any questions and any discussions. Thank you for your time. Have a great day.